the Medical Research Council, the MRC sum score. However, we're doing like the Asia method, if you guys are familiar with the Asia method. So all the MMTs will be performed with the patient laying flat, which makes it a little bit easier than your standardized MMTs, I think. So the movements that are included in this in the MRC score are the shoulder abduction, elbow flexion, wrist extension, hip flexion, knee extension, and ankle dorsiflexion. So the participation preparation, you're going to provide instruction to participant in regards to the purpose of the test and movements. You'll talk through each position before you have them perform it. Sometimes I'll just like passively take them through the position that they're going to be performing. For the conduction of the test, the outcome assessor performing the test must follow the exact positioning of the participant and their extremity as outlined in the instructions below. We acknowledge that there are many different accepted ways to perform these types of tests. However, all sites must use the American Spinal Injury Association methodology. So the different scores that you could have are 0 to 5, 5 being like better that they're holding it against resistance, and 0 being no visible contraction of the muscle or palpable. And then we've added a score of 6 is when you're not able to assess, potentially due to, say, an arterial line board that they sometimes put on like patient's wrist, so that might make it challenging to assess wrist extension. Okay, I feel like that's the most common one that comes up. If the participant successfully completes the grade 3 requirements, so you first see if they can do the movement against gravity, and then you would move on to either adding resistance or putting them in a gravity eliminated position. Okay, so we're going to start with demonstrating shoulder abduction.
Do you have like little cheat sheets of these different types of how to
Position them?
Of doing the muscle of how to handheld positions and all that?
Do we have cheat sheets of that? Do we have cheat sheets of that?
You know,
I don't
like
personally.
little tiny cards.
No, we don't.
Yeah.
It would be
You
nice.
talk to John if you want them.
It would be really nice because it's not like you always have a nexus patient as an assessor, and when you go into a patient, it's like sometimes you just
Yeah, we can do that. We can
forget.
create something with the photos that we have.
It
and
would be
everything.
nice because sometimes it's
fine.
really hard to remember everything.
Yeah, we can do that.
Okay.
Flick for your thought.
Right.
So for shoulder abduction, I'll have like the bed rails down so they can try to go through the full motion. Right, Bahi. So what we're going to do first is have you bring your arm out to your side and try to come all the way up as high as you can. Alright, so he's able to do it through full range. I would bring him back down to 90 degrees and then add resistance. So your hand placement is going to be right here at like the trap. I'll demonstrate on that side too in a second. And then you would push down at about the elbow area. Okay, so here's about a 5 there. So to demonstrate it, I'll stand on this side so you guys can see. So up, you would bring them back down to 90 if they're able to do full range, and then hold here. Obviously I don't do it like this in the clinic, right. But you would have a hand here at the trap, and then one here around like the elbow area, and add the resistance. Okay, so there's a 5 there. So 5 and 4 look fairly similar. You're still adding resistance, but 4 is if they start to fatigue and bring their arm down. 5 is if they can like maintain that position even with all the resistance. Okay, so we'll demonstrate a 4. Alright, so now you're gonna let me kind of break you a little bit, okay? So that's 4. He's kind of fatiguing through as I add the resistance. And then 3 would be that full range of motion. Some people have like shoulder issues, so as long as they get past 90, I consider that a 3. But if they're getting to like here, that's obviously a 2. Okay. So if I think if they're not able to go through the full range, I'll bring their head down. Again, if they're on any tube feeds, make sure you hold them, bring their head down. quickly. Alright. So with assessing for 2, I'm gonna have their arm like supported with mine. I'm gonna say, alright, Becky, we're gonna try to bring your arm out to the side like this, okay? And I'm gonna be palpating here, just to see for any, if he's not able to move his arm at all, I wanna know if he's at least kind of contracting that muscle, okay? Alright, Becky, check my arm now. So he's able to go the full range, so that would be considered a 2. If he wasn't able to like move at all, and I was at least able to feel the traps of the deltoid trying to work, then that would be a 1. But if I'm getting nothing, then it's obviously a 0. Okay. Any questions with abduction? Biggest thing is like positioning of your hands, where you add the resistance, and then where you palpate for any muscle contraction. Okay. So next we'll go straight into elbow flexion. So with this one, Vahi, let's see if you move your arm like that, so he has full range. I'm gonna bring him back down to this position. You're gonna have your arm kind of across like or your hand across their biceps, and then you're gonna be adding the resistance around the distal end of their lower arm, okay? So he's a good 5. Alright, this time fatigue. So I would consider that a 4. And then if he had the full range, obviously a 3. If he was not able to go through the full range, so he bring his arm up like a little bit, but not all the way, I would turn it out to the side. Right, Bahi, we're going to try to bring your hand up toward your mouth. Okay, go ahead and try. Good. So again, supporting his arm. I would be palpating through that as well, just in case he was not able to go through that full range. At least you're able to assess for like a flicker of motion from the biceps, okay? Relax. Alright, so now we're gonna do, I'm gonna stand on this side, but we're gonna do wrist extension. I would first have him, alright, Bonnie, try to bring your wrist up like this. Good. And try to hold it there. Hold, hold, hold. That was a 5. And then move again. So now he's 4, so he's breaking as I add the resistance. And then that's a full 3. For if you needed to remove gravity, I would turn them to the side and still support. You're going to be palpating along the distal radius for any contraction of the extensors here. Right, Bahi, try to move your wrist out to the side. Alright, good. And then if he was not able to move, but I was feeling like a flicker of motion here at the extensors, then that would be a 1. Okay. Any questions with the